Hello and welcome. My name is Dr. John Dombrowski. I'm the Director of Pain Medicine at the Washington Pain Center in Washington, D.C. I wanted to shoot this instructional video for patients out there on YouTube so they understand exactly what they're getting into. I want to talk about several things that you as a patient would need to know. First off is pain healthy? And I think now, today, anesthesiologists can really help patients with chronic pain, whether that's been injection therapy, medication management, spinal stimulation, physical therapy, etc. The other thing is I think people need to be aware of is who's taking care of me? Who's my physician? Well, there are many people out there that say they're pain medicine physicians. I am an anesthesiologist. The other provider out there that's very common is a physical medicine and rehabilitation doctor. They're excellent people also. And as an anesthesiologist, I'm somewhat biased in thinking that we at the American Society of Anesthesiologists do it the best. But I'm sure that's up for debate. Anesthesiologists have been doing pain medicine for at least 40 to 50 years, period. We are expertise, especially doing interventional pain medicine, since we do this in the operating room all the time. My colleagues on the other side, the physical medicine rehabilitation doctors, were normally physicians that took care of patients that need nerve conduction studies, finding out especially how the body works and moves, and recently, over the past 10 to 15 years, have started doing injection therapy. They're both excellent candidates. You want to make sure the other question is, are you board certified? I think that's a very reasonable question. I think most patients expect that their physician should be board certified. As an anesthesiologist, I'm board certified in anesthesiology, as well as your physician should be if you see a pain medicine physician. But more importantly, he should also be boarded in pain medicine, his or her subspecialty. Another question is will I be sedated for these procedures? And the common answer is no. There's no reason for sedation whatsoever for these simple procedures. Again, we thought that most patients needed sedation. We're finding out that if physicians are doing it, it's really not necessary and basically runs up the cost of insurance and healthcare. There's no reason for it. The best way of controlling patients' anxieties or nerves is just having a great conversation with the patient. Having a good doctor-patient relationship is really the best thing to help with any anxiety. Now, on occasions, a patient might need an Ativan or a Valium to help them relax, a friend in the room, and that certainly is reasonable. At times, patients might need to be sedated because of mental challenges, or they simply cannot stay still in order for the procedure to be done well. I mean, one might say that's a pretty hard stance with respect to sedation. I understand that. However, when we do procedures, we want to make sure we always have meaningful verbal contact with the patient. We want to make sure that nothing bad occurs to a patient. As an anesthesiologist, we do this all the time in the operating room, and we've done the exact same technique in the office-based setting. So again, there's really good reason not to sedate a patient. Obviously, cost is one, but we also want patient safety. That's number two, and that's the foremost one, I believe. Another question is, what kind of injection will you be doing for me? Again, most likely, if you're watching this video, you've received a prescription from your doctor that you get an epidural injection. Basically, an epidural is my view of a Coke. There are a lot of sodas out there. We sometimes call it Coke, soda, pop, whatever, but there are many carbonated beverages. And most physicians, internists, neurosurgeons, orthopedic surgeons are very bright, and they just simply write epidural injection. Now, it's my job as a physical medicine, as a pain medicine physician, to look at that prescription, find out exactly what you, the patient, needs.